Hello, and welcome to our course, Calling All First Responders, Real-Time Continuous Glucose Monitoring Awareness and Diabetes Emergencies. We know that first responders care for many people experiencing a diabetes-related emergency. So our goal with this program is to help you understand the challenges of living with diabetes and better understand the reasons behind these emergency situations. We also want to introduce you to Dexcom and real-time continuous glucose monitoring, or RT-CGM. And so you can understand how this technology might help people with diabetes to prevent some of these emergency situations. With this new information, if you do encounter a person currently using real-time CGM, we hope you'll also have a better understanding of how the technology can improve diabetes outcomes. Thank you for joining, and we encourage you to watch all of these brief videos. In this module, we'll be exploring two different emergency scenarios, an older adult 911 call, and then we'll discuss why you might see repeated 911 calls. So here's a scenario that you may have encountered. A 911 call comes in from a wife who's very upset, stating that her husband is confused, he's not acting right. She tells you he has type 2 diabetes and that he takes insulin. So while waiting for first responders to arrive, she sees the insulin bottle he recently used and thinks that he might have actually taken the wrong type of insulin. He typically takes 66 units of a long-acting insulin in the morning, but only takes 12 units of a mealtime insulin. By mistake, she thinks he actually took 66 units of the mealtime insulin instead of 12, and he's quickly become hypoglycemic. When you arrive on the scene, the gentleman is now unconscious. So why did we include a special section on older adults with diabetes? Well, that's because diabetes is very common in the older adult population, with over a quarter of people over the age of 65 living with diabetes. So that's 1 out of every 4 older adults you engage with can have diabetes. And we know this number is expected to rise as people age with diabetes. We also know that regardless of diabetes management, older adults have higher rates of severe hypoglycemia. And so here are some of the risk factors. First of all, it's polypharmacy. Now, people with diabetes can be on many different medications, alone or in combination. And there could be drug interactions or even duplication of medications by mistake if they're seeing more than one healthcare provider. And then older adults that are on oral medications for diabetes can also be at risk for hypoglycemia, not just those on insulin, especially when on a sulfonylurea. There's also food insecurity. Some older adults are on a fixed budget. They could be missing meals, especially at the end of the month. So if they miss a meal, but they continue to take their diabetes medications, then they're at risk for hypoglycemia. Older adults may experience changes in renal function, and that means that maybe their medication is not being processed through the kidneys at the same rate as previously. So they may actually need an adjustment and need less medication. And finally, cognitive decline makes it challenging to manage a condition like diabetes, right? That requires 24/7, 365 management. People may forget to take their medication or may take more medication. Studies have shown that real-time CGM use in older adults lowers A1C and increases time in range, and it is effective for decreasing hypoglycemia and hyperglycemia. As you've learned throughout these modules, reducing hypoglycemia is of extreme importance due to its association with risk of falls and potential injury, also myocardial infarctions, arrhythmias, and temporary or permanent cognitive impairment, and even death. So older adults also have a high risk for hypoglycemia unawareness and do not recognize many of the episodes of mild to moderate hypoglycemia, as they may be asymptomatic. Thus, the alerts built into real-time CGM can really help older patients to manage their hypoglycemia episodes. In January of 2017, Medicare started providing coverage for real-time CGM as durable medical equipment, which has really helped to make this technology more affordable and available for older adults. However, only 40% of older adults with type 1 diabetes and just 5% of older adults with type 2 diabetes currently use CGM. Due to the abundance of evidence supporting the use of real-time CGM, clinical practice guidelines recommend CGM use, and in particular, the ACE guidelines calls out real-time CGM. So ACE says real-time CGM should be recommended for persons 65 years and older with insulin-requiring diabetes to achieve improved glycemic control, reduce episodes of severe hypoglycemia, and improve quality of life. A recent study showed that real-time CGM use in older adults and their care partners can encourage conversations around diabetes management. In this study, they learned that CGM was easy to start, both in person and via telehealth in older adults. And it can really increase the peace of mind for both the person living with diabetes and their caregiver through the suite of alerts and, of course, urgent low soon. And as a reminder, these alerts are customizable, so you can choose thresholds that will be valuable and not create more nuisance alerts. And we really want these to be individualized to the person and their goals. As you've heard before, one of the very unique features of Dexcom is the urgent low soon predictive alert that can enable early action to prevent hypoglycemia. Again, this alert will predict when a person is going to drop below 55 within 20 minutes so they can take action when their glucose is still in their target range. Dexcom also has the Follow app and allows family, friends, or caregivers to follow their loved ones or care person's glucose data. Now, the data sharing capacity can really be helpful to caregivers of older adults and frail patients, especially if they have cognitive decline. When the care partner uses the Follow app, they have their own set of alerts that they can set. One thing that also came about is we created a follower's guide for caregivers. So this is a great opportunity for the older adult and their caregiver to sit down together and discuss how they want to be followed, when they want to be contacted, and what method they want to be used to be contacted. So again, it really creates this great discussion around living with diabetes and creating this supportive environment. So let's review a few key benefits from using real-time CGM in the older adult population. As we know, cognitive changes that may occur as adults age, and we know that glucose fluctuations can be associated with these cognitive changes and also with dementia. So preventing hypoglycemia and hyperglycemia may slow these cognitive changes. We also know that hypoglycemia can increase the risk of frailty in older adults and is associated with falls. So the use of CGM reduces hypoglycemia and hyperglycemia, and so it may reduce these risks. So now I'm going to turn it over to Fran to discuss a different scenario, which is frequent 911 calls.
Other common scenarios involving the older adult in 911 calls are people running out of meds, forgetting to eat after taking insulin, and being confused about if they took their prescribed medications. At times, a relative of an older adult will call requesting a wellness visit to a home of an older adult with diabetes not answering the phone. Sometimes EMTs have found an older adult being hypoglycemic. The majority of people being transported to EDs by EMS are people altered because they are low, are altered because they are high, and also severely dehydrated from hyperglycemia. There are repeat 911 calls for diabetes emergencies. One scenario involves a man in his 30s who becomes combative and aggressive when hypoglycemic. First responders are concerned about the safety of his wife and baby when this occurs. After the hypoglycemia resolves, the man becomes calm and apologetic. Another repeat 911 call is from a man who cannot wake his wife in her late 20s in the middle of the night. She is hypoglycemic when 911 arrives, and they realize that this call is coming in on a weekly basis. These scenarios are so concerning for all involved. The risks are great, not only for the person with diabetes, but family members too, especially if there is a difficult or challenging behavior associated with the altered mental state resulting from hyper or hypoglycemia. The work that first responders provide is complex and challenging and is so appreciated. First responders manage many complex situations with expertise, kindness, and compassion. Thank you so much for everything that you do. As a reminder, once a person has a severe hypoglycemic event, have a higher risk of it happening again. In fact, 54% of severe hypoglycemic events are in 5% of the people. Often these individuals with hypoglycemia are unawareness, where they do not feel any symptoms, and the body also has diminished responses, putting them at risk of repeat episodes. Real-time continuous glucose monitoring has not only shown to lower average glycemia, but lower the rate of emergency services for hypoglycemia compared to blood glucose monitoring in those taking insulin. Emergency medical services is in great demand. Real-time CGM not only helps the person living with diabetes, but it is also an effective tool to reduce the need for emergency services. While we want to encourage use of real-time CGM for all people with diabetes, disparities in access exist. Deb explained that Medicare covers real-time CGM. This map shows the states providing access to those on Medicaid. The good news is that numbers keep increasing. We thank you for watching this module, and we hope that you are more aware of the benefits of CGM in these situations. Our final module reviews the Dexcom CGM system.